Hello all, my name's Dave Smith and I am currently a research champion. I have been a research champion for about 4 years, in fact soon after its conception for UHCW. So the obvious question is, why be a research champion and how did I get involved in research? Something like 6, 7 years ago, I realised that my eyesight was deteriorating in some way. I couldn't quite understand what was going on, but obviously went to see an optician. They immediately referred me to the eye outpatients, and it was come to the conclusion that I have wet macular degeneration, which up until about 15, 20 years ago would inevitably have led to almost complete blindness. Fortunately, things have moved on through research. And when I started being treated, they asked me if I would like to join a research program. This was fully discussed at great length, with all the details explained and all the documentation to cover it, explaining it in even more detail. I was more than happy to do this. I've always supported the NHS and been a believer in the NHS. And medicine does not move forward without research. So I'm more than happy to take part. After about a year on the research program, due to the constant monitoring of both my eyes, they realised my right eye had also started to have a problem. They immediately started treating that eye along with the one that had the original problem. That early treatment and the fact that I was being monitored so closely, in fact, prevented my eye deteriorating in any way. And having recently been to the opticians and told I have what they call 20/20 sight in my right eye, that made me very happy. Research has, without a doubt, saved my eyesight. Being on a research program enhanced every means of treating and monitoring my condition. So just being on that research program has made the world of difference to me. My hobbies are around having good vision. I drive a lot and I'm also a caravanner and I tow a full length twin axle caravan. Certainly something you cannot do without good vision. I'm also a keen fly fisherman. Well, if you can imagine trying to tie flies and trying to secure flies to a line with poor vision, it's impossible. Having now reached retirement and having been retired for almost as long as I've had an eye problem, I am so grateful that I can enjoy my retirement and continue to enjoy my life in what would be a very normal, healthy lifestyle. This would not have been the case without being part of that research study and the developments that are made through research. I hope this helps you understand why research is so important to me and many other people, and the patients do benefit from it. Thank you very much for your time.
Hello, my name is Jane Southman and I am a long-term patient at UHCW. I'm also one of the hospital's research champions, and I've been involved in other ways in research at the hospital. So just a little bit more about myself. I was diagnosed with primary breast cancer in the year 2001. I had surgery and was on chemotherapy for around about 6 months and then radiotherapy, and was very well after that, and really for the next 12 or so years. And then I was diagnosed with metastatic breast cancer at the end of 2014. So I've been on treatment since early 2015, up until really the end of last year. I've taken part in research over the years in several ways. I've been members of focus groups, and one was on the RESPECT form, which the medical staff can complete with patients about their wishes for future care, particularly end-of-life care. I was also on another study where we discussed the initial diagnosis of breast cancer and how the medical staff works with patients at that difficult time. I was more recently went to a focus group meeting where we looked at a new device to measure blood pressure at home and also give an ECG reading. So, and other ways I've been involved in research is mainly in terms of being part of a clinical trial where the researchers were looking at whether a medication taken in addition to hormone therapy would make the hormone therapy more effective. The reasons why I take part in studies and whenever possible, try and accept invitations to participate in research is that I think research is, the crux of it is I think research is really important. I think everybody knows that to some extent, but perhaps because of my research background and because of my different treatments since I was first diagnosed with breast cancer 20 years ago, that I'm really aware of how things have changed over the years, and the treatments would not be available if it wasn't for research. So I'm actually quite realistic that I probably wouldn't be alive if it wasn't for the research that's taken place, because I have been given new treatments over the last 5 or 6 years. And those wouldn't have been available when I was first diagnosed. I'm also hoping to, at the moment I'm on palliative care in that I'm not having any treatment because in December last year I ran out of options in terms of what was available for metastatic breast cancer. I'd had 5 different types of chemotherapy and 4 different hormone treatments over the years. But now my consultant is applying for funding so that if she gets the funding, she can put me on a treatment which is more targeted cell therapy, which is given to people with primary breast cancer, but was not available when I was diagnosed. And these new treatments are obviously all there because of all the people that have taken part in research studies over the years. So it's important because, for me, because I'm hopefully helping people in the future, and there have got to be people who volunteer to take part in research. So really that is, if you like, my story and why I think research is important. And really what it's meant for me is that I would not be as well as I am, and my consultant has said more than once that she cannot believe how well I am given all that I've been through. But I wouldn't be that well, and participating in various I still work part-time for Liverpool University. I am quite active, and that wouldn't be the case if it wasn't for research. So I owe a lot to research and to the NHS, and as well as participants, for those clinicians who actually run and facilitate research studies.